ABG interpretation doesn't have to be scary. With these 5 simple steps, you can smash any gas that comes your way. Start by checking the pH. If it's low, think acidosis. If it's high, think alkalosis. The next is to look at the lungs. The carbon dioxide is the lungs' method of balancing the pH. It's fast, but it's short-lived. So if there's a low level of carbon dioxide, that indicates respiratory alkalosis. Why is it low? Because of hyperventilation, the lungs are blowing off the carbon dioxide. If there's hypoventilation and the lungs are retaining the carbon dioxide, you're expecting a respiratory acidotic picture. And then we move on to the metabolic component. Unlike the CO2, which is short-lived and fast in terms of responding to the pH changes, the kidneys produce bicarbonate. This is much more of a long-acting buffer that occurs in the long run and doesn't really occur immediately. So if bicarbonate is raised, again, you're thinking of a metabolic alkalosis because of raised bicarbonate. Bicarbonate being low, it's going to lead to a metabolic acidosis. So this can indicate, depending on the pH, whether there's metabolic acidosis, metabolic alkalosis, or respiratory acidosis, alkalosis, depending first and foremost on the pH, and then looking at the 2 respiratory and metabolic components. Once you have these, you put them to one side, you want to check the oxygen levels. If the oxygen levels are normal, happy days, great stuff. However, if not, then you need to treat the hypoxia and manage that patient accordingly. Finally, putting everything together in one picture. There are 3 main outcomes that can happen. If the pH is normal, CO2 and bicarbonate are all normal, that's a normal ABG, you'll be pleased to know. However, if the pH is normal, but either the bicarbonate or the CO2 are slightly off, that indicates there's a complete compensation from either the respiratory or the metabolic component, leading to a normal pH and an overall compensated picture. Partial compensation occurs if the pH is abnormal, so it's either acidotic or alkalotic, and either one of the 2 components or both, the carbon dioxide or the bicarbonate, are also working hard to try and partially compensate for that imbalance. So there you have it, 5 steps to take you through an ABG interpretation. If you found this useful, check out our 7-day free trial at mediclaunch.com for more tips, tricks and techniques like this, whiteboard medicine, to help you smash your medical exams.